I'm going to be starting my Instagram live in just a couple of minutes with my esteemed friend and colleague, Dr. Joel Cohen, who will be joining us in just a moment. And happy to see you all joining. I hope everyone's having a good summer so far, at least. Hi, Bridget. It's good to see all of you here. I actually just had another virtual event in my office. We've gotten the Evoke, which is a new hands-free radio frequency treatment to treat the submental area and also under the chin. And I love it because it totally does not hurt. You see a result right away. I did it. I did it today, both in the submental area and also under my chin. So it provides like an immediate effect, and over time, it also causes tightening, and it's able to get rid of some of that stubborn submental fat. So I've really been enjoying that. And gonna wait for Dr. Cohen to join us, and as soon as it's 7 o'clock, I'll actually do the formal introductions. Oh, so the procedure that I was talking about before is something called Evoke, which is a new hands-free radio frequency treatment that's used for skin tightening and lifting of the lower face and neck area. So, going to So, Dr. Cohen should be joining us in just a moment, and there he is. Hi, Joel.
How you doing? What's going on?
Good. So nice to see you.
Good to see you as well. Just increasing my volume there.
I joined a few minutes early, so there are a couple of people on, but I'm going to wait until exactly 7 o'clock to do your formal introduction.
Fantastic. So what's going on in New York?
It's a lot of masks. Luckily, people here seem to be wearing masks, so I'm really happy about it. And I think I saw like the other day there were like 0 deaths. So we're doing okay for now, but because of what's going on in the rest of the country, it's only a matter of time before everything starts going up here again. How are things by you?
Things are all right. I mean, it's surprising when you go some places and people aren't wearing masks, or there's a sign at the edge of like a restaurant for takeout, employees must wear masks, and you walk in and they have it on their chin. So completely ineffective. Honestly, we're learning ways to sort of grapple with keeping the nose free of irritation or those little pressure sores. I'm putting a piece of Duoderm across my nose oftentimes in the morning, and then using one of those little spacers behind my ears. Otherwise, it's just so painful by the end of the day.
It is. I find that I have to like run into my like little office and like take it off for a few minutes, like, or a few seconds, like kind of like give myself like a little break, because it does get to be a lot. And I was in the OR the other day, and I was trying these like other pair of like goggles, and like one of them was like fogging up, so it was like really hard to see. So I had to get them to like change my eyewear. So it's like it's
those,
really not easy.
When you're doing resurfacing and you have that second mask on.
Yeah, I had 2 masks on. Yeah.
And then you have the shield on, or you're wearing loops and a shield. I mean, it gets to be to a point where there's so much on, and then when you go to take it off, everything just falls off.
Yeah, it's very hard, but a lot of these things are very hard. I find it hard to actually see clearly. So it's like you're finding the right protective equipment that's protective, and then yet doesn't impede your vision is challenging.
the Duoderm plus like a little piece of tape over that, so I don't have to peel it off my nose. I peel it off the Duoderm, has helped me prevent fogging. So
Oh,
I
that's
think
a
that's
good idea. So
yeah.
I say so now it's 7:01, so it's time. So I am so excited to be having this IG Live with my friend and colleague, Dr. Joel Cohen. And he is, for those of you who have not heard of him or know him, he is an international expert on aesthetics and skin cancer. He is the director of About Skin Dermatology in Colorado. And he also serves on the teaching faculty in dermatology at the University of California at Irvine. He's an expert in everything. He's like written like 253 articles, book chapters. I don't know how many textbooks. He's won so many awards. And not only that, he's like all around like great guy. And one of the best people I know. So thank you for joining me.
I appreciate it. It's nice to be here chatting with you.
Yes.
And it's a 5 o'clock here, so I'll have
it's right. I have a ribble. So it's 7 o'clock here. And I know that you wanted to, so before we get started, I just want to say, I want to share like a quick story about that. Me and Dr. Cohen Joel, we met at a meeting, an international meeting. We were in Copenhagen, and we spent the day together because like after the meeting was over, we wanted to go on a tour, but we somehow decided to go on a Segway tour, which I had never been on a Segway, and I was like terrified. But luckily, Joel, because he lives in Colorado, he's also an excellent skier, so he was like explaining to me how to like balance myself without killing myself, and he made sure that like over the cobblestones that I didn't totally go flying. So thank you.
We had a good team. We had about 6 of us, including Jason Bloom, who, as always, was wearing his Nike Air Jordans.
Right, but and he's like the best because he like arranged the whole thing, so we just had to show up.
That's true.
He was like our tour director. He's like, okay, we're gonna meet at this time. We're gonna go here.
That's right. When Bloom does something, it was done well. It's hard to even imagine doing group activities now. It's just so foreign to us.
I know, although I guess like on a Segway outside, with social distancing, that's probably like one of the few things you could do.
Yeah. But you're cruising fast enough that if somebody's right next to you or behind you, they're getting some of that. But yeah, that was fun. It was freezing that day.
It was cold. It was cold. Remember, luckily they gave us those like gloves, right? So that when you're holding onto the Segway, your fingers don't get totally frozen.
Segue, pun intended, to like protection devices. We were wearing a hat. We were wearing gloves, in case we fell. And honestly, at this point,
the only one who was really going to fall would be possibly me. Nobody else was like falling.
So, but it's so hard. Everybody's so happy to be outside right now after being at stay-at-home measures for so long that I think legitimately people are forgetting about sunscreen on one hand. And on the other hand, they're wearing masks and they're thinking, okay, gosh, what more can I do? I'll just skip the sunscreen. So we're seeing, tremendous amount of melasma flares on the forehead and temple areas, just, outside that mask area. So, I would encourage people to simply remember sunscreen, remember to reapply. Key ingredients are really important. And, think about hats and think about the different things you can do to protect yourself from not only skin cancer, but aging skin is such a huge component. So as a surgeon, you're always telling people, about ways that you can rejuvenate surgically the periocular area or their nose or, different types of things with brow lifts. And so much of this just stems with everyday activities that's really maintenance in terms of sunscreen and skincare, and then getting to all the fun stuff that we're going to talk about in terms of procedures.
Yeah. So what are your favorite sunscreens?
So personally, I'm like a keep it simple. I wear Elta Clear. It has zinc in it, but it also has some chemical sunscreen, octinoxate, and it just rubs in really well for me. If I'm playing tennis or if I'm biking or if I'm swimming and I'm really sweating, you know, the Elta Replenish is a mineral sunscreen. It's just, I don't typically shave that much, and it really just gets caught in my hair. So I find it easier for social outings to just rub in something that rubs in really well.
So what do you think about the spray sunscreens?
Spray sunscreens are great, as provided that they have the right ingredients and that people really rub it in. People have done some studies on if you're just spraying it, like let's say on the trunk, and you're not physically rubbing it in, then you obviously have gaps. So I have little kids at home, and you know, they're never excited to have sunscreen on, but the sign of a good aesthetic physician's, you know, kids in terms of smell is, last night I kissed my daughter goodnight, and she hadn't jumped in the shower yet, and she smelled like sunscreen. And I said, that's perfect. That I was on a Zoom call with my office, and I'm like, that's exactly how I want you to smell before you take a shower or bath at the end of the day.
No, absolutely. I mean, when my kids were little, I would, before we went outside, I would like lather their entire bodies up with sunblock, because at least I figured I would get like on like one good coat before the day started, you know, until they did whatever. But a lot of times when they go to camp or whatever, I know that like no one's going to sit and lather, you know, sunblock on in a protective way. So they're all using those like sprays. But my younger daughter is really like good about the sunblock, and my nieces unfortunately are not. Like they don't want to wear sunblock at all. And my daughters are like, you are ruining your skin, and their answer is, don't worry, Aunt Jenny will fix it.
Well, honestly, my oldest remembers a point where I was finishing a textbook I did on skin cancer reconstruction, and I had like a chapter on the kitchen table, a chapter on the dining room table, chapter on my desk, my wife's desk, the ping pong table, and you know, all these chapters have unbelievable photos of just huge defects. And I think that made an impression on her.
Oh,
she's
no,
probably, she's the best one as far as sunscreen. I don't really have to like put up an argument with her, but my other ones, you know, it can be tough. And my son's at camp right now. So he's at overnight camp for 6 weeks. And honestly, like I told him, dude, when I see pictures, I better see sunscreen on your face and a hat on your head. And we started seeing pictures, and I'm not sure I see any sunscreen. I definitely don't see the hat.
Well, you better send him the spray, because that's your only hope.
I think I'm going to be calling camp and just telling them we might have to send them home.
Camp, they really need the spray, and the only other thing that they use are one of those like sticks.
He puts up a fight regardless. You know, he says it's sticky, it can't hold his lacrosse stick or his tennis racket. Or
no, it's definitely an issue. But you're right. Like seeing some of these pictures. When I was in medical school, I spent a month doing a rotation at Johns Hopkins, which serviced like West Virginia, and there was a guy who had a basal cell that was the size of his whole cheek. And he was walking around for years with it covered, like, and we had to do a radical maxillectomy, which means that includes taking his eye. And right. He was so thin and whatever that he had to get like a prosthetic for that part. So skin cancer, the moral of the story is skin cancer is serious. And yes, we are concerned with, you know, looking pretty and not aging, but we also want to make sure that we don't get cancer. So, yes.
You know, honestly, one transition like to that is that there is a laser that helps from an aesthetic standpoint in terms of pigmentation and smoothness to the skin and light reflection to the skin. But it's also actually FDA cleared for precancers, actinic keratoses. And that's actually a niche where, you know, some patients are really interested in that right now, where somebody might come into somebody's office and say, you know, gosh, I feel a little guilty spending money on something cosmetic right now when I'm really watching things and, you know, waiting for the economy to sort of recover, you know, and that actually is a step in the right direction, where there's something that has a medical benefit, but there's some cosmetic clear-cut benefit as well. So there's a Consumer Report July issue where I have a little quote about that specific fact, and it's in their sunscreen issue. But the laser is a thulium laser, So the 1927 wavelength can be helpful. And I think there's three types right now. First is the Lutronic Lace MD Ultra. Second is the Cyton Moxie, which is the part of the M-Jewel platform, which is a thulium laser. And then Solta's Dual, the Fraxel Dual, has that as well.
Yeah, but I find that even, you know, even when you treat people with Levulin and then it's activated, I mean, those people look better after they get rid of their actinic damage.
So, you know, for years, there were a lot of studies looking specifically at that. So folks like Michael Gold have published pretty extensively on the cosmetic benefit of doing photodynamic therapy, either with a blue light or other sort of light sources. And then Jeff Dover, Tina Alster, Ashish Bhatia, several people have actually done studies where they've even done split face comparisons where they have photodynamic therapy, either Levulin or Ameluz are the two in the States right now. And then they activate it with IPL or pulse dye laser or one of those other wavelengths. And you're right, they have improvement in smoothness to the skin. They have improvement in the pre-cancers, but they also have improvement in some fine lines and pores and things like that as well.
Yes, they kind of go hand in hand, but I agree. You know, you want to get rid of that damage. It's not good.
So when you see somebody in your practice that does kind of like this, I want to see, you know, some improvement, or I'm concerned about the jowling. You know, we're on a call right now, and many people, when they're on a call, they're really critical of themselves in terms of their chin, the jowling. So how do you help these people make the right decision about their choice?
So usually what I do is, you know, I will usually ask the patient what bothers them the most. And, you know, I'll have them look in the mirror, but I also will have photos taken of the patient, and I'll show them how they look in the 3/4 view and the profile view, because often people don't realize that. And then I kind of go over for every patient an overview of what happens in the aging process. You know, how the face of the shape changes, and I go through the different layers. So I'll explain to them that usually their changes are not due to one thing, but are due to many changes. And the way that we get the most natural result is by treating those with different modalities. So I usually tell them, especially for the lower face, that they're not going to get significant improvement, maybe even with one treatment, that we usually need to do a combination of treatments to get improvement.
So we both have a lot of different devices in our offices, you know, and one of the hardest parts is really, you know, having a patient sort of guide them in their decision in terms of what to use. A lot of times they'll come in and they'll have a sister or friend who've used one thing, or they've seen an advertisement in one of the ladies' magazines about another thing. So, you know, I mean, there's radio frequency and ultrasound and volume replacement with fillers. So your conversation with people, including surgery, is probably pretty interesting.
Right. Well, usually I try to figure out right off. I don't like to, I feel like the discussion when it includes surgery and non-surgery is often very confusing. So I'll usually start off by saying, like, are you interested in, like, do you want a surgical procedure? Do you have the downtime? Or, you know, and if they're like, yes, I want surgery, then if that person wants a surgical result to their lower face, that there really isn't a treatment that's going to compare to that. If they're like, I don't want to do surgery, then we go into discussion number 2, which is like, which device and, you know, which combination of things are we going to do to get that better? So obviously, you know, for me right now, still the gold standard of non-invasive treatments in the lower face and neck would still be the microfocus ultrasound therapy. And in my hands, you know, the patient gets a very good result. I do give them all numbing injections, so the treatment is not painful. If the person has severe laxity, then I tell them that they need to repeat the treatment, and often I will repeat the treatment at 6 weeks in order for them to get more improvement. I usually will combine that with, you know, if they have significant platysmal banding, with a neuromodulator at the same time, and possibly some, you know, filler along the jawline and in other parts of their face to restore a more oval appearance.
So when I jumped down, you were talking about Evoke.
Yes.
So
that
I missed the beginning part of that.
Yes. So that would be, so Evoke is a newer treatment, but what I love about it is I actually like did it right before this call. I mean, like earlier in the day, is I do feel like it gives some immediate improvement. So there is some like lifting that occurs, and it is totally pain-free, does not hurt at all, and it is hands-free. So it's great now, like in this time of the virus, because the patient can sit in a room basically by themselves. There's not anybody else there, and the treatment is very comfortable. You could either like fall asleep, you could have another treatment done, and the machine is able to maintain, like you can set the temperature, so it maintains the correct temperature, and I think it's a really good treatment.
But you have to do repeat treatments
weekly for a while. You have to do repeat treatments. Like you need to do between 4 to 6 treatments unless you're going for a more like immediate effect. So it's like a treatment that you could do, let's say, before a Zoom call, or if not that we're going to any parties now, but if you were going to an event, then it does really help. And I was actually very happy with, you know, the results that I'm seeing from it, and the patients seem to really like the treatment.
You know, honestly, you know, with procedures like that seems to make a lot of sense, where there's very little discomfort. You really understand that you have to do a few treatments. Positionally, right. It's hard to get before and after pictures for a lot of patients on those type of devices, because it really obviously depends on if your chin's in exactly the right spot and you're looking at the same point. But sometimes we do see some decent improvement with something like that, or off therapy and things like that. You know, as a dermatologist that spends a lot of time doing Mohs surgery and resurfacing, I'm certainly used to the bigger procedures. And my favorite procedure to do is heavy laser resurfacing.
I know.
Takes 2 weeks to heal, but it's so worth it.
I was like, no one's doing that in New York. And you were like, no, they will. But they really don't. They don't want to. But yes, you have some beautiful results from those resurfacing lasers.
Thanks. I have an article in press with a bunch of photos from like just heavy resurfacing. And, you know, there's a few people that do that, Jay Burns in Dallas and Jason Posner in Florida and myself. And, you know, we teach it for site time. But I really, you know, when some people say, you know, gosh, I live in New York and I can't get somebody to do that downtime, or Boston, I can't get somebody to do that downtime. I think it's tough, because actually you can definitely, you know, really get patients to understand that if you do one treatment and you have 10 days or 2 weeks of a healing time, and that's going to be a better overall effect in the long run than doing a series of a bunch of smaller laser procedures, you know, that have, you know, 5 days of downtime at a time, or 6 days of downtime at a time. It really does make sense. So if somebody can use their vacation, or use, you know, and right now it doesn't seem to be a huge problem. I mean, everybody has downtime, everybody's at home, and they're gearing up for some major event, like, you know, their kid's wedding that was postponed for a year or something like that.
So what do you think about, there has been some controversy about the use of these ablative lasers during this time, like this COVID? Do you feel like there's any increased risk, or? You know,
well, first we use an air evacuator for all these patients, so it's literally right next to the face. And, you know, people have discussed, you know, is this a time to potentially put a pause on it? But patients really have, in many cases, the downtime to do something now, where they're not going back to their office until maybe the end of the summer, or the fall at some point. Or I've had patients even say longer. So they really want to do these things. And, you know, from an infection protocol standpoint, if they're at home, probably the risk of infection is less, just because they're in a pretty clean environment. they're not going out and about after a few days, and really the degree of sun protection and everything that they can do right now while they can stay at home and not have to, go here or there or take their kids to school and be in the car where they could get
No,
some significant sun. I,
absolutely.
I think it makes sense from a timing standpoint, as long as it works for them.
Right. Right. Yes, I think, definitely people have downtime now, so it's kind of ironic because they are more willing to do things that might be a little more invasive, and especially since they can either hide out at home or they can hide behind mask a little bit. It does make it easier. But I find that most of the time that people will tell me that they'd rather, even if they the only time that they're willing to do a more aggressive procedure is if I'm doing a surgical procedure and they're already having downtime, then having a more aggressive resurfacing is fine. They're all for that. It's just having them. For me, it's like they only want to have that downtime if they're doing some other like surgical procedure. They're like, okay, well, if I'm doing something else, then I'll do that. They want to then combine the downtime. They wouldn't.
Honestly, that happens a lot with my Mohs patients as well. So if I reconstruct something, let's say on their forehead or on their upper lip or on their nose, and we're thinking of doing some laser and some dermabrasion at the same time, then the time to heal for that is going to be a week. And for many of them, they just shrug their shoulders and they just say, if I'm going to take a week to heal in one spot, I'm sort of checked out anyway. Let me just resurface the whole face, and I'll do that at the same time and not have to worry about that down the road where it's not as easy to take a week off.
Yeah, absolutely.
So what are your favorite combinations right now? People are coming in for, since you opened back up, injectables, laser procedures with less downtime, tightening devices.
Yeah, I know. What's so funny is there's all of this talk about, how the eyes and the upper face are kind of more in focus because everyone's wearing a mask. And I would say most of my patients coming in are still concerned with their lower face. So the submental area for people of all ages, it seems to be a really big issue. So we're doing a lot of either submental liposuction, Kybella, alt therapy. Like there's a lot of those types of treatments. I guess because either people have really been studying their faces more, or seeing themselves in a camera, and they're horribly bothered by this. So we're doing a lot of stuff in that area. I usually do combine it with a neuromodulator. Often they do require some like chin augmentation or a filler in that area. So stuff like that has been really popular. Obviously, the Botox filler, alt therapy combination is always popular.
So, for us, I think alt therapy and Kybella combo is a great one, making sure to tighten the skin here and lift the skin here, but also deal with some of the fat below the chin.
Yes.
So that's been a big one. A lot of the resurfacing patients, I also do like a bipolar fractional radiofrequency, like we have Genius RF. So for people who have like that crepey skin and, etched lines, it really does well to do both of those at the same time. We have a nitrous unit, a Pronox, so that actually makes it, I think, easier for people, who have some issues. But like you, I do a full block for the resurfacing for their face. So most of those patients don't really need it. For all therapy and the radio frequencies, we do use a fair amount of Pronox, for those patients as well. But many of these things, patients don't need any anesthesia. Like I do a lot of Q-switch laser with thulium, and their downtime is going to be like 2-3 days, no big deal. But we can certainly do more, like Halo, the 2.0 version of Halo, which is much quicker and more efficient for patients. You could tweak it so it's 2-3 days downtime or 4 or 5 days downtime. So really having all these different options, it's fun and exciting to have a bunch of different pieces of equipment and things that we can use together.
It is, because there's so many different ways to utilize them, and it is fun. But that's why this Evoke is really, really fun. I think also because it doesn't hurt. It really is such a pleasure to like have a device that you don't have to worry about. Like, how are you managing the discomfort. You know, you could just put it on and be like, okay, you can sit there and you'll look better in 30 minutes, you know?
So, you know, one thing that's different now is that we're not having residents or fellows right now. We're not having drug reps in the office right now. So we had a new hire. Her first day was on Monday, and she was with me, and I was just doing my usual routine. And she looked at me when we finished with the patient. She said, "You just used 6 lasers at once on one patient." And I looked at her and I said, "You know, yeah, I did." She's like, I just, you know, but you know, that like moment of surprise where, you know, so I had pulse dye laser, I had a Q switched, I was doing some BBL to some larger spots, I was doing thulium to the hands, I did profractional and resurfacing on the face, and all of a sudden, like, I was like, yeah. So, you know, people don't realize that, you know, we have our rooms designed so that there's like enough power sources and that the power grid in the office is done so that.
Oh yeah, I mean that's like a big part is having like the right electrical in your office.
So in our office, and then, you know, you have to think about these things where you have like a Buffalo air evacuator as well as a Zimmer going on. So you might have like 8 things plugged in.
I know, it's seriously.
So it's pretty amazing to have all these different options available and to use them at the same time in combination to really give people, you know, sometimes they don't want to come into the office a bunch of times, especially now. And they're just
Right.
like, let's do treatment, face, neck, chest, hands.
Sure.
And, you know, we can do that.
I find that once the people are in the office, they're like, I don't know when I'm going to be able to come back. So let me, you know, do the things that I can do now, you know?
Well, definitely, you know, we're spacing people out much longer. So we're calling them in from their car. So if somebody comes in for Botox or Dysport and they're not on the schedule for filler, and then they're like, yeah, you know, I don't know, do you have time to add this? And they don't have topical on. I say, sure, you know, just let's put some topical on, because chances are, you know, my next patient is not for a little bit, because it takes some time to call them in. So we try to make it so that we're not using the waiting room much or at all, calling them in from the car, having somebody do temperature checks, and all that whole process takes a long time. So if you have somebody in a room already, you know, it's obviously easy to add another procedure or appointment.
Yes, I agree.
So how much rhinoplasty have you been doing?
You know, surprisingly, people are still also very interested in rhinoplasty. So a fair amount of rhinoplasty, still even like a fair amount of like either submental liposuction, facelifts. People now have like some downtime to do surgery. So maybe if they were considering it, you know, people don't know if they're going back to school or when they're going back to school. You know, when you can do things virtually, it gives you a little more, you know, just a little more of some downtime, you know, ability.
So, well, you mentioned resurfacing, you know, and the whole process of it right now during COVID, but, you know, from a standpoint of either rhinoplasty or a facelift, it's pretty similar. I mean, in terms of it's going to be a while to heal. So what are the discussions you have with, you know, patients at this point about those procedures?
You know, most of the time, you know, the cast for rhinoplasty comes off in a week, so it's not really such a big deal. You know, the problem is that the COVID testing really throws like a whole wrench into it. So depending on, I've had a bunch of people go for the antibody test, which the hospital doesn't want. The hospital wants the antigen test to see if they're actively infected. So there's a lot of this, and, you know, waiting for the test to come back, knowing that the test could, you know, the patient could be canceled. It has to, like, especially around the whole July 4th weekend, between everything being closed and then getting the patient tested and then having the test come back. It's very stressful, you know, but that's what it is. But otherwise, it's not really so different for the patient as far as healing goes. It's the same thing.
So you're saying that the acute test, the PCR test, is based on a nasal swab, and before the surgery with you, obviously it's easy, but if they do need to be tested at some point after, Is that something you're concerned about, is putting the swab in the nose?
No, I wouldn't be concerned about that.
So my little dude didn't love it, but he had to be tested before he went to camp. They required it for everybody.
Sure.
And I mean, it's a swab going that they shove into your
And no,
nostril.
it goes in, it's a nasopharyngeal swab. So it's not just a nasal swab. The nasopharynx is back like at least, 7 or 8 centimeters, so you can imagine that's not going to be comfortable.
So, a lot of these things, that we're learning right now about, people in terms of physicians who had significant exposure, especially in New York or Boston, where there were so many patients that had exposure, and they may have gotten sick, where, they may recover, but they still have some sort of, issues related to their lungs or a persistent cough, or in some cases we hear about people requiring like a pacemaker. And Nick Cordero, as an unbelievably talented Broadway actor, a young guy, it's hard to imagine, all the things that went on there and what type of exposure with the amputations, and then ultimately, unfortunately, passing away. But it's pretty scary to think, of all this out there that we really don't understand. And then, patients are asking questions about blood type. Many people don't even know their blood type, but I think, at this point, there's been a couple papers about type O people have a better prognosis than type A people in terms of that as well. So, we as physicians are sometimes the only people that, these folks are actually seeing. Somebody may go to get their hair done or go to the nail salon or somewhere, and then, come, out to see us every once in a while. So I think it's important to stay up to date on these types of things, and for us to have knowledge about these acute tests and these antibody tests. I was totally surprised I tested antibody negative, because I flew from Maui Derm to IMCAS at the end of January, early February. There were a lot of people at IMCAS
I remember
that were wearing masks from Asia. And I had this wicked cough that I actually had, throughout like the whole month of February. At Miami Cosmetic Surgery, I saw you. And honestly, it was hard to work out for several weeks there. So I was thinking I definitely had it. And, my antibody test was negative so far, and it was the more specific Roche test. So, for a lot of folks out there and our staff out there, it's really, it's important that we really educate them that, I have my staff with an agreement that, we're very careful in the office. Everybody's wearing masks at all times. And my expectation is that they, don't have gatherings outside the office, and they'd be really careful outside the office as well.
This is true. You have to kind of form like a little pod where you have an agreement that you're being careful and not really interacting with a lot of other people, so yes, it has to be, we're relying on each other to keep each other safe, because we know, like, when you're in the office, someone can take off their mask. It's just like, even if for a second, so it's difficult. So I totally agree. But yeah, I think we have a lot to learn about the virus. I don't think that we understand it. We don't understand like all the things it could do. We don't know what the sequelae or, what are going to be the long-term consequences of being infected with this virus. We don't know if we're going to get a vaccine, if the vaccine is going to work, if this is going to be a seasonal, type of thing like a flu, that every year it will be different. It's really horrifying.
Yeah, I mean, the huge question is this going to be like a flu vaccine that, may hit 30 or 40% of people, or is this going to be other types of vaccines that require continued progression of immunity, that you have to actually have continued steps in it? It's just, and it's tough right now. I saw some optimistic news. There was a study that came out of Hebrew University and Mount Sinai together, looking at some specific treatments that were already available in terms of Tricor and other types of things, where people were having a better prognosis. So I think that's pretty cool. It was in the news today. And then there was some synthetic antibody that came out of California that people are working on to sort of shut things down a little bit. So I think, hopefully there's hope on the horizon, but it's so hard for our kids, and wondering if they're going back to school. It's hard for our staff and figuring out, if they're going to have to homeschool kids and be able to work full
Yeah.
time, for us. And then for patients, just to know, are they going back to in-person office time, or are they going to stay remote and keep doing these virtual, meetings and do their business virtually? It's just so many uncertainties. I think it's really hard for people right now.
Yeah, it is hard because we don't really know, even if we don't know how long it's going to go on for. There is no real end. Like, there's no end date. Like, I think anyone would be able to maybe tolerate it if okay, January 1st, we're gonna, things are gonna change, but we don't really know that. So it's that uncertainty, and living with the uncertainty is very difficult for everybody. It's not easy.
So I think, one thing is when people are doing Instagram Live like this, or they're on these video-based conferences, from GoToMeetings to Zoom and Adobe and all these different things. I did Microsoft this morning. They all have different levels of detail in it. And, I'm actually surprised at how many people want to do lip augmentation at this point. So, some of these types of ways that these interact, you don't necessarily have a great shot of the crinkles below somebody's eyes, right, or the little etched lines, but things like volume or intraorbital tolerance.
I agree. People are still very interested. I told you, both in the lower face and the lip filler also.
So Kiss.
The Kiss, yes, I like Kiss.
I love Kiss. So since the launch of Kiss, I think that there's been a resurgence of interest in our practice as far as lip augmentation. There's every day just blowing through a lot of Kiss. I'm really enjoying it. I'm not seeing that much swelling. I like the fact that it could be used for the etched lines really well on the upper lip. I honestly think
I only had one patient who still got quite swollen, but the other people did not.
Well, certainly less swelling than typically we saw with Restylane Silk. So it's just Restylane Silk. I think with Restylane Silk, there can be more tendency to have more swelling. Kiss, definitely less swelling, definitely gets into these lines better. And I feel like oftentimes you do these little serial puncture into the lines, and I feel like I have to really massage my thumb by manually down to sort of pull it. And with Kiss, it's just so smooth.
It is.
I think there's a lot less of that, and I think people are really happy.
Yeah, I think it's a very nice product.
So what do you do for post-treatment bruising? Are you having people come back and doing what type of laser procedure or something?
So I have this Ellipse Nordless laser that has one of their IPL applicators, is actually very good for bruising. So usually with one zap of that, it goes away quite quickly. I also just got that Elastin anti-bruise cream. So I tell all the people ahead of time, not to take any Advil, aspirin, all that stuff. I give them arnica ahead of time. I have them continue it afterwards, but otherwise I do zap them if it's significant.
Honestly, I think, it sounds like we're doing very similar things, stopping non-essential aspirin. So obviously if somebody has a history of a heart attack, stroke, blood clot, or AFib, I'm going to leave them on it. But otherwise,
I agree.
We tend to stop it, stopping vitamin E, ginseng, garlic, ginger, ginkgo, kava, kava, celery, fish oils, omega, MSM, chondroitin, glucosamine, St. John's wort, all that stuff I think is important. But honestly, and so many people are drinking alcohol at this point just because they're home, that I think that's a huge source of oozing.
I know. They're so sick of me saying that. I'm very big on saying that. They're like, what do you mean I can't drink? I'm like, well.
Well, for us, people come over, they come to your house for a holiday or dinner or just like a housewarming type thing. They bring you a bottle of wine. And, so I go through stages where sometimes I'm really good about, I label the bottle of wine and who gave it to me. And other times, it's just busy. A lot of people are coming over. You're like, thank you. And you put the bag away or the bottle away. So since March, we've made a conscious effort to sort of go through, the bottles of things. I got this Ab Vivino where I actually take these little pictures, and then you can see, you know, everything about the wine. You can see the rating and how much it costs and whatever. And I've been like really systematic. The Cabernets, the Merlots, you know, the Pinot Noirs, all these different things. I have a friend yesterday who's a patient who, so it's my birthday on Friday. It's kind of a weird time to have a birthday when you really can't have a big birthday and get together with people.
Your birthday is this Friday?
Yeah.
And my birthday is the following Friday.
Brian Beisman's right around that too. He's within a day or so of this. So she actually brought me like Four Roses bourbon, which is an amazing bourbon. And I'm so excited. And she also brought me, her husband is like the Hulk. Like this guy he's a New Yorker. He's a tank. And I mean, he literally looks like the Hulk. And his favorite wine is rosé. And I always make fun of him. So rosé
is like a summer wine, though.
He is so into rosé. He knows everything about rosé. They gave me, it has like an M on it. I forget the name of it. You know, so honestly, I think that I'm drinking, other people are drinking. You take what's in your house. You have more time to actually like look things up in apps and categorize things because we're not running around anymore. And all of a sudden, like you get to the point, you're injecting somebody and they're like, you're really oozy today. And she's like, yeah, I had some wine yesterday. Well, how much wine did you have? Well, we had a couple bottles, you know. And honestly, I had a guy not that long ago who things were not going well, you know, like in many businesses. And I was doing Mo's on him. I said, man, you are so oozy. I don't have anything in my notes the last couple times we did anything about it. And he's like, Joe, I'll be honest with you. I had a box of wine last night. And I said, you mean a bottle? And he goes, no. He goes, my wife and I drank a box of wine last night. So I think that's like 3+ bottles. So I think there's definitely a lot of people drinking right now, and they have to realize that can interfere with the bruising and the procedures that we do.
Absolutely. That's 100% correct. And often people will say to me, right after I inject them, they're like, is it okay if I have a glass of wine tonight? You know, that's what they usually say to me, which I know if they say they want one glass, that usually means at least 2 or 3. So.
You know, I honestly, you know, some of the post-procedure restrictions, I typically tell people after filler, I prefer that they not, you know, go to the dentist for a little bit. And I think that's easier said right now. I think there's you know, there's some people that are just going to the dentist less right now in terms of, you know, pushing back routine teeth cleaning in some cases a little bit, or, you know, if something needs to be done. Like my mom, who's 77, and I worry about, I haven't physically given a hug since early March, and she hasn't hugged my kids, and I see her, we get together outside, and, you know, I'm very far away from her. You know, but she had to get a crown done this morning, and there was no way around it. Just needed to be done. So I think certain things do need to be done, you know, in that respect, where there's aerosolization of different products and drills being used and other types of things. But you know, by and large, when I tell people after filler, you know, I prefer that, just because of the risk of bacteremia and bacteria in the bloodstream and potentially seeding the recent filler or causing some sort of delayed nodule, I think it'd be best if they avoid it for a little bit of time. Most people don't have a big problem with that right now.
No, I mean, that's a good point. So how long do you usually tell them to avoid the dentist after the filler?
10 to 14 days. What about you?
I mean, similar. I don't often, like, otherwise, if I know that they have to get like a significant amount of dental work done, or they have to go back multiple times, then I usually have them do the dental work first and then come in.
Right.
You know, if they're in the process of doing something and they don't know how many times they have to go, or then I just say, you know what, let's just wait until you're done and then do it, because you never know.
So in addition to certainly having a lot more wine and cleaning out the wine area of the house, my other discovery during COVID has actually been, you know, I was a huge M&M almond fan, and, you know, you and I have spent a lot of times talking about candy, and I know your husband does a lot of candy stuff, but my new thing is caramel M&Ms, and I have a few every single night.
You like them? I don't like them.
You know, honestly, we have literally upstairs, we have almond M&Ms, peanut M&Ms, regular M&Ms. We have the fudge brownie ones. We have the M&M minis. We have pretzels and caramel are by far the best.
I don't know. I didn't like them so much.
Really?
Mm-hmm.
Honestly, I have to limit.
I did not like them.
I had to limit myself to 4. I try to have 4 a night. Sometimes it's 6, you know, but what can you do? Because they're addicting. They come in this family-sized bag, and my little one who gets like more exercise and does more cartwheels and everything else everywhere, it's like no big deal. She takes a handful and she just eats them, you know. But I want to be, you know, conscious of all that kind of stuff. So I watch my M&M caramel and my caramel M&Ms and my almond M&Ms.
I like the almond M&Ms better than the caramel.
So what's in development in the candy world right now?
My husband is developing these like fruit snacks that are natural, so they don't have like chemicals. Like there's some company that's like making them sour with like lemon juice, so he's working on that.
Really?
Yeah.
That's cool. Honestly, you know, I've been trying to be better about the gummy candies. I have so much sugar and everything else, and my kids eat all those sour different things, but they do eat those roll-ups.
Much better than chocolate. I just like the gummy candies much better than chocolate.
You know, and honestly, you know, when patients very often used to send things into the office where they come in. So like yesterday, a patient brought a bunch of bundt cakes, but they were the tiny individual bundt cakes. And I could see that they were done differently. Like in the COVID era, like they were wrapped in a little doily, you know, differently so that it was easier to share and they had less in a box and those types of things. But, you know, it's weird. Like, you know, patients oftentimes will bring something in or bake something or, you know, send in one of those little bouquets of fruit and things like that. And it's just quiet in there. We've had a couple, you know, launches of product where somebody wants to tell us something, and we've done these virtual type things in the office. But it's just so hard. And those, you know, those bags where people are used to having like either chips of like, you know, you order Chipotle and they have the chips on the side. Like we're not doing any of that really right now.
No.
And certainly, you know, a big bag of candy or something like that, nobody's double dipping into right now. And it's really, it's tough. I think we have to find ways to look for individually wrapped things for our staff and sometimes, you know, avoid food altogether.
Yeah. Yes, it certainly is. It's difficult.
So,
I mean, everything has changed.
So with my study team, you know, we're used to having pretty regular meetings, and you know, these meetings, it's kind of weird. You're sitting there and you've got a mask on and you're talking, you're having like administrative meetings or study meetings. So we decided as a group that we're going to have like an evening micro brew. So I'll get the beer. We sit outside, you know, it's separate picnic tables, and we'll just do a study run through with a beer, and we'll do that every other week. Because I think that we have to find ways that collectively, you know, we can safely spend time together, but outdoors, separate tables, and, you know, and try to be, you know, cognizant of all the things that we can do to try to protect ourselves right now, but still get our work done and, you know, be together we can talk about things.
No, absolutely.
What do you guys do?
You know, we try to have like our meetings in the kind of in the waiting room now, and we're all like try to space apart, and we're wearing masks, but we have like a little like morning like huddle, so we get like, right, you know, and we have some other meetings. But it's a challenging time, you know, and I'm in the middle of Manhattan, so it's not like I can have someone wait in their car to come in, you know. So luckily we have more, you know, we put everyone into their own like little treatment room. We're checking the temperatures, we're screening them ahead of time, you know. But it's just like a weird time, you know. And again, like there's all these like virtual meetings and virtual Zooms, but it's like it is what it is, right?
So, and Matt, you know, the part about, well, first of all, I'm very cognizant for industry and companies that have spent thousands or millions of dollars developing different products or drugs. You know, it's a tough time to launch these things. I think Kiss was a very successful launch because people got excited about it with these virtual meetings. We went over the data, those types of things, and you're buying syringes, and it's not such a huge investment
Right.
for physician practices. But for Evoke, which is a fantastic technology, you
Right.
know, for them to get traction in different offices and things like that right now, where people aren't doing very much in terms of having reps in the office or having these virtual lunches, it really is dependent on some of these meetings. And then, you know, for a meeting, I've recorded a few videos for different meetings in the past couple of weeks. There's Scale, which is coming up in a week and a half, and then
Right.
Masters of Aesthetic, which is coming up after that. So I've done some lecture virtual recordings, as well as patient like injection or procedure recordings. You know, the lecture like this is much easier. You're following your laptop, but it's hard to sort of gauge your audience. You don't know
Yeah,
about each
it's very,
cadence.
it's I think it is hard. I was doing this like virtual global meeting like a couple of weeks ago, and it was like the meeting was like a little delayed, and then you had to sign in, and then you had to wait, and then there were questions. It was like, but I don't know what's happening now with this Vegas meeting.
Well, I think, you know, the Vegas meeting is September. There's also the Monaco meeting in November. I think some of that's up in the air, but for some of these other like demos that we have to do, if we have to record it, you know, you're still with the patient. So the patient doesn't have a mask on if you're injecting here. You've got the HEPA filter on, you've got the air evacuator. But to speak to the camera wearing a mask and recording these things is really challenging. I mean, you've
Very
got to
challenging.
speak up, you've got to speak over whatever's in the room, right? And nobody can read your lips.
No.
So, you know, these injection videos are really more of the video or the laser video, a technique where you can't really comment so much. So sometimes people are dubbing over those. I mean, it's, while the virtual meetings sound great from a lecture standpoint, I think they can still be good, but it's hard to gauge your audience.
Yes.
In terms of the procedure, I think it's really tough to do that and to communicate it. I think for companies out there in terms of launching products or product theaters, a lot of things can go wrong. At ASAPS, which was in April, the American Society of Aesthetic Plastic Surgery, everybody's in like sort of a general session on the computer, and then when that ends, like you're given a choice to go into these different halls on the computer, and it didn't work. So we had to have people sign out.
Right.
Sometimes people comfortable environment.
Oh, I think it's going to, this Instagram live is going to turn off in a minute.
Oh,
it's going to turn
right.
off because we've been on
Got it.
for a while. So thank you so much, and I'll talk to you. It says we have one